In this lesson, I will discuss types of quality measures. Avidis Donabedian, a pioneer in the field of quality measurement and evaluation, developed a framework that serves today as the foundation for quality measurement. According to this framework, quality of care can be measured based on structure, process, or outcome. Structural measures are those pertaining to a provider's resources and capabilities to deliver healthcare services. These resources and capabilities can entail education, training, staffing, and availability of technology. For example, structural measures for a hospital can include staffing levels, such as the number of registered nurses per patient. For a physician group practice, an example of a structural measure is the percentage of physicians with advanced clinical training, board certification, fellowships. Process measures refer to the clinical activities providers undertake for patients and whether those activities are consistent with scientific knowledge as presented in clinical guidelines or standards. Process measures can relate to the underuse or overuse of healthcare services. Many measures deal with underuse, that is, clinical activities that should be performed under certain clinical circumstances but may not be. An example for a nursing home is the percentage of nursing home patients who receive a pneumococcal vaccine, as nursing home patients are often at elevated risk for pneumonia. For a hospital, an example of a process measure is the percentage of patients who are admitted with a heart attack who are placed on aspirin. For a physician group practice, a process measure is the percentage of patients with diabetes who have at least one annual test for blood sugar levels. Regarding measures dealing with overuse, these are clinical activities that are often performed in situations where they are not appropriate or of low value. An example for a physician group practice is the percentage of patients prescribed antibiotics when there is no documented bacterial infection. Process measures have been widely used in the U.S., and many that are currently in use are drawn from the Healthcare Effectiveness and Information Dataset, otherwise known as HEDIS, a platform of process measures that largely focus on quality for primary care services. Outcome measures refer to the health status of patients, the effects of healthcare services on patients. Outcome measures can refer to events that are desirable as well as those that are undesirable. An example of a desirable outcome measure for orthopedic surgery is the percentage of patients undergoing hip replacement surgery who are able to walk up a flight of steps within a specific period of time following surgery. An example of an undesirable outcome measure for orthopedic surgery is the percentage of patients who develop one or more serious complications from hip replacement surgery, such as blood clots. Some outcome measures are considered to be intermediate because they pertain to a patient's physiological state that can lead to longer-term health outcomes. An example of an intermediate outcome measure is a patient's blood pressure and whether it is in the desired range clinically. Very high or very low pressure can lead to negative health outcomes such as stroke. Presentations of the Donabedian framework, such as the one included here, often refer to causal linkages among structural, process, and outcome measures. The idea being that good structure and good process are important antecedents to positive patient outcomes. A special class of quality measures are those focusing on patient safety. In particular, patient safety indicators are used for screening for adverse events that patients experience as a result of exposure to the healthcare system and are likely amenable to prevention by changes at the provider or system level. An example of a patient safety indicator is leaving a foreign body in a patient during a surgical procedure. Quality of care is a multidimensional concept, and there are various ways to measure it. The Donabedian framework has served as a foundation for much of the progress in measuring quality. However, as the science of this field moves forward, there will likely be new thinking regarding types of quality measures. The development of patient safety indicators is an example of such progress. Now that you have seen this video, I encourage you to think about possibilities for new types of quality measures.